Welcome, bienvenidos to today's workshop, A Beginner's Guide to Data Literacy, Practicing with DataShare on Community Indicators for Planning and Evaluation. And we are co-facilitating today's workshop with Eva Holt from DataShare Santa Cruz County, and we're joined by guests who will be speaking about their use of DataShare indicators to understand community impacts of their programs. Sage Catton and Julio Andrade from Cradle to Career will be with us. Rita Hewitt from the Health Improvement Partnership and SafeRx Coalition was planning to join us, but can't be here today. So we'll try our best to share some information about SafeRx, but hope you'll get to hear directly from her in a future session. Today's session is held in English with Spanish interpretation. Gisella Carrasco, whose voice you're hearing, is providing consecutive interpretation, and she'll also translate any written comments or questions in the chat. And soon we'll switch to simultaneous interpretation, which is provided by Stella Lauerman. And Eva, are you feeling up to describing DataShare, or would you like me to do it?
Hi, good morning. Thank you, Nicole. I caught a bunch of food and a bug over the Thanksgiving holiday, so excuse my voice, but I'm happy to be here today. My name is Eva Holt, and I'm a social impact consultant and project coordinator for DataShare. For those who are less familiar with DataShare, DataShare is an interactive platform with over 400 indicators from local, state, and national sources. The platform strives to have an updated version of all data and reports with the most current information, and DataShare is constantly changing with new indicators being added periodically. We try to be the central hub of information that creates alignment by allowing everyone to measure outcomes with the same metrics and indicators, and to integrate data sets such as the safety net clinic utilization data that previously was not easily available publicly. So DataShare gets used in a variety of ways by students, researchers, advocacy groups, program evaluation, which we'll talk about today, grant writing, and fundraising. And so I'm happy to be here today and be supporting this conversation.
Thank you, Eva. You can go back to your hot tea now. So today, I know many of you mentioned this in your introductions about what brings you here today. You're in the right place if you're here to understand some steps and tips in terms of program planning, evaluation with a focus on equity, and using the many community indicators that are available on DataShare and elsewhere for these purposes, for program planning and evaluation. And we also want to highlight some local initiatives that are doing exactly this, using these community indicators in these ways. We're going to feature some examples from Cradle to Career and just a few highlights from SafeRx. Although, as I mentioned, those of you who may have missed the introductions, Rita Hewitt couldn't be with us today, so we won't have as much detail on SafeRx, but we'll show you where you can find some of that on DataShare. And we'll also have a chance to practice some of the things we're talking about. And we're hoping that all of this will be useful at different points of experience, different comfort zones with all of this, and that you'll feel free to share your own examples and questions with everyone who's on the call today. So before we get into some of those details, we wanted to see where everybody is in terms of program planning and evaluation. So there might be some of you on today's call who hear those words and want to do a happy dance. So hooray for you. Some of you might feel a mix of excitement and apprehension when you hear those words, depends on the situation. I'd probably put myself in that category. Maybe it's something that puts you to sleep or into a deep trance, or even makes you just want to run from the room and you're making yourself be here so you can learn more about it. So all of those are fair game. They can be different day to day and program to program. So let us know where you fall today on hearing those words. We'll give just a few more minutes. We've got one happy dancer. Oh, two happy dancers. Awesome. Okay. We've got a lot in the shared excitement, mix of excitement and apprehension. Some deep trance. Nobody's running from the room yet, so that's good. Well, maybe we can increase the ranks of the happy dancers after today. There's where it landed. Thanks, everyone. Okay. And I put the link to DataShare if you want to follow along with anything that we're doing. And we'll have some other links and resources to share with you as we go along. Just a reminder to please feel free to share your questions and comments and your own examples as we go through this today. And we'll have a specific part of our agenda to do that a little later. And you're probably going to hear my voice a lot because of various sniffles and things on our team. So bear with me here. Okay. So let's start with a program planning definition. Throughout today's conversation, we're going to talk about some impacts that accrue to a program. That might be the set of activities that you're most immersed in and working with. But we're doing these things in a program for a larger purpose usually. And that's when we verge from a program to impacts that accrue at a community level. So the program is, as you can see on today's slide here, the set of activities that you've planned, and you have some resources to support them that are designed to achieve some specific outcomes for some individuals, some groups, and maybe at a community or population level. So that's a definition of a program. And planning is just how you do that. All the design, your intentions to achieve these, which activities you choose to pursue, and how you support these activities to reach the outcomes that you've hoped for. So all of these things can change over time. And one of the ways they change is by thinking about learning about what you are or are not achieving. And the key steps in this planning process are to try to identify the main issue you're trying to address, for and with whom, and how you're going to do it. It's sometimes helpful to use something called a logic model or a theory of change to map this out. And again, not to say that it's written in stone and can't ever change, but just to think about the relationships across all these things. Which activities, where to deploy resources, what they yield in terms of outcomes. And we have some resources on the Core Institute part of the Core Investments webpage that have some recorded webinars about how to do a logic model or theory of change if you're interested in pursuing that. But just there are many ways to do this, but it's just a way to try to document what you're trying to achieve and how. And then some equity considerations that are really important to consider for all of these steps and how they relate to each other are involving the people that the program is serving in the design and the implementation and the evaluation. So throughout this process, and doing that as a way to examine and address the root causes of why your program is needed, what you're trying to achieve. For example, what's the role of systemic racism in the structures and systems in which our programs might be embedded? How do we incorporate equity into the different pieces of what we're talking about today? So everything from collecting data to how programs are staffed and to the kinds of questions we ask when we're evaluating something. And if you want to start looking at how the two programs that we're featuring, Cradle to Career and SafeRx, think about some of their goals and outcomes and how their program planning relates to those, you can start looking at the links that Gisella will put in the chat for their landing pages on DataShare. And I'll show you in just a moment how to get to those. If you are interested in doing something similar for your own program, we're also happy to talk about that. Any questions so far? Okay, great. Let's talk about some similar steps and definitions for evaluation. An evaluation is just an assessment of all of the things we've just described. And it sometimes is a word that is all by itself causing people to run from the room, but it's really how you are looking at the activities and efforts that are underway to determine whether or not what you're doing is working in the way that you intended. Is it yielding the results that you hope to achieve? And if not, why not? So I really think it's helpful to think about evaluation not as this gotcha moment, did you succeed or fail, but more as a learning moment. What can we learn about what we're doing? Because even if you're not achieving your outcomes, or especially if you're not achieving your outcomes, it can give you a lot of clues about where you might change things in order to do that. So it would really be helpful to think about evaluation through that lens, and we'll talk about some resources to help you do that in just a moment. So what are the steps in an evaluation? Well, first, you want to be ready to do that. So is your organization in a place where you have something to evaluate? Do you have enough of your program underway? Do you have some sources of data about what you're doing, whether it's from intake forms or interviews or focus groups or other kinds of data about your outcomes? Have you had a chance to even think about what your outcomes are, whether they're appropriate for the level of effort that you're able to deploy? Who's involved in your evaluation? Is it program staff mainly? Do you have an outside evaluator? Are the people that you're serving involved in thinking about what those indicators might be? Do your funders have some guidance for you? So there are lots of different ways to engage people in the evaluation that you're doing. Is the description of your program something that has parameters that can be evaluated? Is it too vague or broad? Is it specific in ways that give you clues about the indicators and outcomes that you want to track? And what are the elements that you would include in something that we would call an evaluation design? So what's the purpose of your evaluation? What are you trying to find out? What are the questions that you're trying to answer? Who is going to use your results? And what are the equity dimensions similar to the program planning about what you're asking, who collects what, who interprets what, and who gets to use the results? How are you gathering all of this information, and how are you sharing it? So these are all considerations when you're thinking about something that would be called an evaluation plan or design. There are lots and lots of resources online and elsewhere about how to evaluate programs. So two that we're going to highlight for you today, and if you have others that you found helpful, please let us know in the chat. But if we have a framework, sometimes it's helpful to just prompt thinking through the different pieces of an evaluation. So a very common program evaluation framework that started in public health but applies to other types of programs is one that was originally developed by the Centers for Disease Control and Prevention, or CDC. And we'll put some links in the chat to both English and Spanish versions of that. It's at this point 20 years old or so, but it's had some really good staying power because it's got these broad steps about engagement, program description, how to gather different kinds of evidence, how to justify and determine some conclusions, and how to share what you're learning. So that's one set of resources. And then I'll just stop my screen share for a moment and point you to something that's on the DataShare website. And that's called the Core Continuum of Results and Evidence. This is, you'll see a link in the chat as well. This is a bilingual resource that Nicole Young and I developed as part of the Core Investments Framework. And it's tagged to some other tools including the way that DataShare thinks about promising practices. And what you can see here is a true continuum from something that's just an emerging idea or practice that you're just testing out, to something that's a good idea, but you're not sure yet whether and how it's been evaluated or works, and that's part of what you're trying to determine, to something that has more information about effectiveness, to something that might be more rigorously evaluated and therefore constitute an evidence-based practice. I just want to emphasize that all of these are valid and important ways to look at a program. Doesn't mean that one is better than another. It just means that you have had a chance, or someone else has had a chance, to provide more evaluation information about it, and therefore you know more. Your program may be anywhere on this continuum, which is fine and great. But if you wanted to move along the continuum, what this guide offers are some questions that you might want to ask yourself about each type of program. So for example, if you're in an emerging program, you might be saying, I wonder what would happen if we tried X. I wonder if this has been done before. If you are collecting information about your program, you might be saying, should we keep doing this? Should we do more of it? If so, do we want to expand in different directions? And you can see similar questions for things that would be a program that's a good idea or an effective practice. And these are really evaluation questions. So that's why we're sharing it here. It's a way to ask yourself, is our program doing what we intended? And if so, how? And if it's falling short, what can we learn from that? So the mindset or habit of asking yourself these questions is really what evaluation is. So it doesn't have to be a one-off, a report that nobody ever reads or sees, but it's really a process of asking yourself those questions about your program. Any questions so far? Okay, let me go back to our slides. So we've talked about program planning and evaluation of a program. How do those link to the community indicators, which is the main topic we wanted to talk about today? So community indicators are the ultimate impact that your program contributes to. And that language is really important. You alone are not responsible. Your program is not responsible solo for achieving a community indicator, but you, along with other efforts, will contribute to it. These indicators tell one part of a multifaceted story about well-being or its absence across the community. And we'll see how Cradle to Career and SafeRx exemplify this approach. When we're trying to look at community indicators, the first step is to try to identify and select some that work for you. So they're available either on DataShare or somewhere else. They're accurate for your purposes. They're responsive to your activities and others. You have a way to match what you're doing to those indicators, even if they're much broader than what your effort is targeting. And you have ways to share the impact that you have on those community indicators. So you might be looking for things like, is this the right time interval? Is it something that's immediate or far off in the future? Kind of depends on what you're doing. And again, like all of these pieces, there are some really important equity considerations. So to look at community indicators, are they telling you what you need to know about differences by age, by race or ethnicity, by a zip code or geographic location? And in data speak, that means that the indicator has disaggregated data. So not just a big lump that averages and smooths everything out, but something that is split into pieces that let you see differences that are important to what you're doing. And we'll hear a little bit about that with both of these local examples as well. So just as an example, and I'll go back to DataShare for just a moment here. Excuse me while I maneuvered there. Okay. You'll be hearing more directly from Sage and Julio about Cradle to Career, but this is the Cradle to Career page under the local progress part of the local progress tab on DataShare. And this explains the Cradle to Career mission statement and goals. So you can see embedded in these goals some ways that Cradle to Career is looking at some of these indicators. We'll talk more about those in a moment. So for example, here are some of the desired long-term outcomes for Cradle to Career. And again, these are things that they're not achieving by themselves, but are contributing to and are tracking. So one example would be chronic absenteeism. So sometimes that's something that Cradle to Career targeted before COVID, but there can be a national or global event like the COVID pandemic that affects absenteeism. And you can see in some of the data that we'll talk about in just a moment that there are variations or spikes that have nothing to do with your program necessarily, but do affect how you're thinking about what you're doing. And I'll just say there's a similar page for SafeRx and other local programs, and you can browse through these at your leisure. Sorry, my internet is a little slow. So it doesn't want to share SafeRx. Oh, there it is. So SafeRx is a response to the opioid crisis and overdose deaths. And one of the specific goals of SafeRx was to reduce the prescriptions for opioids in our county. A really specific goal that was influenced by this initiative. And Santa Cruz County, you may know, went from being one of the counties in California with the highest per capita rates of opioid prescriptions, that means per person for our county population, to one of the lowest. And we also see some variations in that by zip code. So you can see, if you want to look through some of the SafeRx examples on DataShare, you can see what some of the other indicators are that they're looking at and tracking. And Tracy, I see your question in the chat here. Do you have an example of how other nonprofits have aligned their organization's goals with the community indicators? I think both of these are actually examples of that. And there are quite a few others. I would encourage anyone on the call who has some other examples to share. We'd love to hear them either now or when we do some of the sharing from our reflection and practice exercise. And Kaki, I see that you also had a question about quantitative information and not qualitative. So DataShare is a compilation of a lot of quantitative information that might be harder to obtain otherwise. So one of the advantages is that it collects things from national and state data sets that you would otherwise have to hunt down individually. But there are qualitative data on DataShare in the nature of reports that are on some of the local initiative pages. And absolutely, qualitative data are important for all of these purposes. So sometimes they're what's called a mixed methods evaluation, some of you may be familiar with, combines quantitative data from surveys, for example, with qualitative information from interviews and focus groups. And sometimes they inform each other in the sense that qualitative data from an interview or a focus group might tell you what you want to ask about on a quantitative data collection like a survey. So it might help you shape your questions or the language in your questions or the response categories. And again, that happens most effectively if you have an opportunity to test all that and be informed by the people who are closest to the issue you're trying to address. Let's see. I want to make sure I'm not missing any other questions. Just scrolling back here. Okay. Okay, I hear from Eva that she is feeling well enough at the moment. The hot tea worked to interview Sage and Julio. So I will take you up on that, Eva, but do let me know if you have any coughing or anything that you want me to step back in.
Thank you.
We're going to hear directly from Sage and Julio about some of these.
Yeah. Thank you. I mean, I couldn't miss the opportunity to chat with them. So we'll see if I can make it through the questions. I think I can. I mean, I think what is really wonderful about partnerships like this is that it does address the qualitative balance in terms of what data we're collecting, the stories that we're telling, and how we contextualize the interaction between that population health trends and then what what folks on the ground are seeing, like cradle to career, and to have that opportunity to really talk about the differences between the population health trends versus what folks are seeing, and have the program level data to explain those differences. Whether it's in a story form or whether it's trends over time, which Cradle to Career has been collecting data on their programs for a number of years that interplay with the community population data. So I have a list of questions for Sage and Julio, but feel free to not answer these and talk about the experience that you've had with collecting this data and using it for your advocacy efforts. So the Cradle to Career, as we saw, they have a local progress page on DataShare. And we'll just start with asking you to share with the group how you selected the community level data indicators that you have on that page for Cradle to Career and any others that you use for your programming. So, just what did you choose to track and monitor and why?
Thanks, Ava. I can start us off here and then I'll pass it over to Julio. But as Nicole mentioned earlier, kind of some of the baseline points for choosing our indicators is looking at data that is accessible and responsive. And then another thing that we've paid attention to as our organization has shifted, and then the needs of our community on a local level, and then kind of even beyond that have changed. We've seen a shift in like indicators we may have chosen like 6 years ago prior pandemic and the indicators we choose now. And so that really speaks to the responsive need in choosing which indicators we select. And I'll let Julio kind of talk about how the indicators are linked back to the needs and dreams of our families.
Yeah, thank you, Sage. Hello, everyone. Yeah, and I think something that Sage mentioned, one of the things that we always focus with Cradle to Careers, centering the parent voices, right? The family's needs, their hopes and dreams. And this has allowed us to align the hopes and dreams of the families to some local and level indicators that we can align and measure throughout the years, right? So it's going back to the hopes and dreams workshops that we offer for families. That's where we hear the constant dreams that we all have for kids: good health, good character, good education, community strength. And then we find the level indicators that we can align it to, right? So it's not only allowing parents to center our work plan moving forward for Cradle to Career, but also providing the opportunity for them to have a voice in our table, right? Making sure that they get the things that they need in order to thrive and have a good health, good education, good character. And this is something that we always heard from community partners and other community leaders as well. Like, yeah, these are universal goals, right? For everyone to have good health, good character, community strength. But one of the things that we're emphasizing now, it's like not every family has the same opportunity for good health, good character, right? So we align that to the opportunity where we can also help us determine what are the basic needs the family need at the moment, and then bring them to the table to help us find that opportunity for them to like have a leadership opportunity at their community. I know we have Yadira Flores in the space today, who is our promotora, and it's just having the centering the voice of the parents in order to make success happen, right? So it's something that we always lead by example when it comes to like selecting the level of indicators that align to the hopes and dreams of the families, but also to a way that we can track it moving forward.
Thank you. And then I think that you guys are really good about thinking about this. So I'd love to hear about the process as well, of choosing, just what were some of the equity dimensions of the community indicators that you chose?
Yeah, I think that this is a really great question. And I think that, we've, I think probably all seen in like historic data practices that they haven't necessarily always been equitable and considered all the populations that they're serving. So this is something we definitely try to really do intentionally. And just like inherently, before we even get into the specific indicators, like our 4 pillars are really like based upon a holistic model of the community and the families. And we really strive to combine both youth and adult data in the community indicators that we did select, to provide a more holistic model of the families that we're serving. And I think, especially in our work with community strength, our focus on connectedness and belonging is really important, because I think that especially like students' connectedness in schools, for that level, for that indicator to be high, that means that students of all populations, especially in this diverse community that we live, are feeling like they're being accepted by their teachers and their peers, and that they have a place there. So I think some of those practices are embedded in the indicators that we chose. Julio, I don't know if you have anything to add to that.
Yeah, and just going back to the equity dimensions of the community indicators that we choose is always, like I mentioned at the beginning, reflecting back at the hopes and dreams of the families, right? So it's also working with community partners like the school districts, like Live Oak, San Rafael, San Lorenzo Valley, Santa Cruz City schools, that help us be there with the families feel safe, right? And I think it's just working with community partners that make our work, steer our work moving forward with those families, and just finding the right partners to help us move forward into the equity dimensions of the work that we do. And one great example of how it's being implemented is through like the hopes and dreams of the families. An example going back to making our 4 pillars like universal goals for everyone in a community, but we ask them like, what is it that prevents you from having good health, right? An example can be, the lack of physical activity after school for our kids. So, right, partnering up with Mid-County Soccer to provide free soccer clinics for kiddos. Connecting with the Zumba instructor to provide the Zumba for families at their school sites. So I think our biggest partners and the work that we do are the school districts, because they provide us with the safe location for families where they, like I mentioned, they feel safe. But also now we have transitioned over into like having youth involvement in our initiative. I can share that one of the things that I take as a highlight from C2C is from last year. So it's an example of one of our local parks not feeling safe, right? Not feeling kids not asking the school principal from the school side saying, hey, don't go to the park because it's not safe, right? So working with the school district to identify how can we make that park safe for kids to come and enjoy being at the park, right? So centering the voice of the students, say like, hey, how can we make this a safe place for you guys? So we transitioned that park into like on Wednesdays, as we call it, Tribe Outside. where we work with local partners like Fuerza Soccer, Flow, Boys and Girls Club, Live Oak, will provide the adult supervision, but also bring rich and cultural activities for the kids to play while you're at the park. So now we are hearing from the school principal, they're welcoming kids to go to the park now, right? That's a big transition that happened with all those partners in place, but always centering the students' voice, right? Identifying that what is it that you guys need in order to feel safe, and also provides that equity dimension that we provide to like having everyone in that place where we need to make decisions, right? And this is aligns to them wanting a safe place moving forward. So like I mentioned, is having that. Another great examples of like the recreation activities that we offer for adults and kids is going back to the hopes and dreams. Like an example, we have Zumba every Tuesday at one of our local school sites for parents to come and participate in, right? And just free Zumba for them, and a way for them to also build that connection with other parents across the county. So it's just some great examples of that. Going back to COVID, before COVID, we were planning on launching what we called our Promotora de Salud. So we put that on hold while in pandemic mode, right? So, but one of the things that families advocated is like, we need this program to arise, right? Because right now it's the critical moment for us to talk about health, right? So promotoras right now, we started with 10 promotoras 3 years ago. Now we're in the third cohort where we have at least 25 promotoras actively participating in that, which allow us to also bring promotoras from Watsonville into this space. So now it's increasing the opportunity for other, not just local, with the places where we're working on directly, but we expanded it to outside the whole county. Like I mentioned, families from Watsonville being able to join our promotora cohort and having that space for them to feel safe and connected with other families as well. So that's a way that we have included the equity dimension into the work that we do.
Thank you, Julio. Thank you, Sage. I'm just putting into the link one of the indicators that are into the chat, one of the indicators that you guys mentioned. And I'll just say, you know, it's been a couple of years since we went through this process together. So I'll one thing that I remember that you were very clear about was language. And so when we were looking at the list of community indicators that aligned with, you know, the core menu under, you know, collective results, and then also under your pillars, we created a list of indicators that might be most important for you to be looking at. My understanding is that that list was then shared with your parent leaders, and also you were very clear about being asset-based. So there were some of the data points that you didn't want to use because of the language. The language was not asset-based. So let's say, you know, student connectedness. I don't actually remember which indicator you decided to scratch off the list, but you know, student connectedness, if you were to flip it and say, oh, you know, students who are disconnected, I remember you were very clear about those aren't the kind of data points that we're tracking because you know, they don't align with our core values of being asset-based, and our parent leaders also they're not connected to that kind of tracking. You know, that's not how we want to track our the well-being of our families. So I don't know if you want to add anything to that, but you jogged my memory when we were talking right now.
Yeah, thanks, Ava. I think that's a really important point to highlight. And I think there's like, we're kind of trying to stay ahead of the game in some ways, because I think like historically, like a lot of data has been kind of deficit based and like trying to shift to asset-based work. And like, as we ask families, like, what are their hopes and dreams, and try to like, you know, paint it in that light of like, what do you want to work towards? And like inherently part of that is like identifying barriers and what might be holding certain families back from that. But really it's centering our conversations and our data endpoints and like what we're working towards and what we're trying to achieve, rather than like what we're trying to move away from. And while I think those other data points do have like a place and value sometimes, I think it just kind of speaks to the culture we try to like uphold as an organization, to like keep the focus on like what we want to work towards, what we want to attain for everyone. And yeah, and I think that's something like our parents model for us, and is reflected in like the partners we choose and the programs that we hold.
Thank you. I think it's a great example of how to be really clear around the data, and holding it to your values. Okay, so if you want to just tell us a little bit more about how you've used these community indicators that you selected to inform your program planning.
Definitely. I can start us off here. So I would say these community indicators are a very big part of our planning and the work plans we develop for each year. And then just kind of like the larger results chain that our organization has. Again, inherently that these indicators are based off of these 4 pillars and then areas of focus that were all identified by families and for families, that it's built very intentionally into our work plan and our program planning. So like essentially at one end of all, we have like these big community indicators that like we're working towards, and then we kind of like work back to do like the more immediate outcomes we're looking at, and then kind of how programming is going to work towards those outcomes. And so we kind of like work our way back with these community indicators being kind of the big end goal kind of like shifts we're hoping to make. And we work backwards for that to just kind of break it down in a more tangible way for like ourselves, for our community. But I think having the alignment in these indicators and our planning is really important, because it creates like congruency of goals, and it creates shared objectives for like ourselves and partners. So when we're sitting down with someone and saying like some of the examples that Julio mentioned and some of the indicators that are seen are on page in terms of like recreation activities and physical activity. So then when we like talk with our recreation partners, we can kind of sit down and be like, we're working towards this shared goal, and then develop like the programming and kind of the more immediate short-term outputs that will ultimately hopefully shift the needle on these larger indicators that we're working towards. Again, parent voice and youth voice being like a really instrumental part of this whole process. So I think that's been like a really powerful thing for our team, is just having it really woven into all of the work that we do. Julio.
Yeah, and also just adding to what Sage is mentioning, part of the work plan based on the hopes and dreams of the families is not just about getting the family's input, right? It's now this year we have transitioned into like having those parents in the table when we're planning our activities. An example of that can be, recently we've been working with Triple P First 5 about bringing parenting workshops to the school sites. Now we have parents in that space talking directly to their leaders and be like, hey, this is what we need, in order for them to also look at the needs of the families directly and hear their feedback directly from the parents. So now we're bringing parents into that space where they're helping us build the program from first conversations all the way to implementing it with other families. So it's having that in the mix of like, hey, this is your hopes and dreams. Let's work together on having making sure that this is implemented throughout during the year, right? So that's a great example of how that's going. Another great example about it's like one of the things that we hear from families is when it comes to digital literacy, right? Just making sure that they know how to jump on a Zoom call, how to write an email. Right now, we're working with the Santa Cruz Public Libraries to bring those workshops at the other school sites in order for them to feel like, like I mentioned, the school sites are the place where they feel safe and secure. So it's about bringing a resource directly to the families and making sure that they feel connected in that way. So it's working also with the school districts to like, hey, let us borrow some Chromebooks that you have available for parents to use. So it's a building community in that way, right? Just bringing everyone from that it's needed in the table, but always centering the parent voice, having the parent voice next to us at all times to assure like, hey, is this something that is going to work for you and the families, and making sure that we align that goes to the indicators that we see here. Like that's part of the work that we do. We also talk to the parents about the indicators that we have to track, and then see how can we plug that into the work that they want to do at the community. So it's like aligning our goals to the indicators as well.
Thanks to you both, Sage and Julio. The process that you've just described of working backwards from these broader community level impacts and trying to get these shared congruent goals and incorporating the voice of families and youth is very much how these logic model theory of change tools work. Just, you know, with a, I always think of it as how is what we're doing now related to these broader things we're trying to achieve. So you've really filled in and kind of fleshed out a lot of the steps in thinking, working back from outcomes, but also working forward from activities and involving others. So you're contributing along with your partners. So thanks for those great examples. We're also curious about just how you think about evaluating what you're doing, the assessment part. And I know that's embedded in some of what you've just described, but are there specific evaluation questions that you're trying to answer with the information that you're collecting, or the way that you're asking about what you're doing, asking yourselves about what you're doing?
Yeah, I think this is a great question. And yeah, I mean, evaluation is such an important part of, I think, any community-based work. And I think that a lot of people here could probably sympathize as leaders in organizations, like evaluation information is so rich to us, and like holding awareness that folks find evaluation can be really exhausting, and they're, you know, getting evaluated from so many different ends, whether it's like community-based organizations or schools. And so I think in that, and acknowledging that, we have to be really intentional about how much we burden folks with evaluation. But we do have evaluation processes embedded in most of our programming. So for programs like our Family Learning and Leadership Circle, which is like a countywide advocacy group, after each session, we have an evaluation form that folks fill out, and that can like asks things about just basic satisfaction levels. It can ask about how much, you know, their confidence in speaking up on a certain subject might have shifted as a result of the session. And then we do a lot of other like broader types of evaluation processes. So those can be like kind of pre and post survey oriented. And I think that's really helpful for establishing a baseline. And then again, if we check in at the end of year to see how much their satisfaction has changed, their you know, confidence in accessing local health resources has changed. And so it really depends on the program, how the evaluation questions are asked, or if we're doing kind of, you know, more broad survey across school sites. So yeah, again, I guess some other examples. So like level of satisfaction, it can be about asking about their sense of belonging. It can ask about if there's like additional areas where they could be using support that are currently not being met. And I think that kind of, yeah, evaluation is a really big part of the work that we do. And I think it's important to have like those regular touch points on programs that you're offering. So like if you're hosting different types of workshops, doing those on a regular basis. And then if you're looking for like larger shifts and change, to do kind of like a pre and post survey, like after an activity's been hosted for like a couple of weeks or months. And we just, for the first time this year, we usually do a spring survey every year, but this year we decided to do a fall survey across all of our school sites as well, to have kind of like that starting point, and then kind of something to refer back to at the end of the year when we do that second survey. Julio, I'll pass it.
And also I think one of the things that we do through our work is just collect the stories from those families, right? How our impact is making a difference in their lives, right? It's also, that's the way that we collect data in a way, but through the stories of the families. And I know that at the end of our page to DataShare, there's a quote from one of our local families, right? That one of our families that said that this changed her life, right? This transitioned her life into having a space for her to feel safe and feel connected to someone else. And I can read the quote. It says, "Before Cradle to Career, I felt isolated and depressed. Now I have a real support and the opportunity to make a difference." So to me, that's what matters the most when it comes to data and collecting all this information. Data is important because we can see how can we better serve our community, but just hearing this impact of how families feel when it comes to Cradle to Career, it just makes a difference, right? It just makes a difference of the work that we're doing. And like I mentioned, centering their voice is also an important piece of the work that we do.
Thanks, Julio. That's such a great example of showing through that story and that quote what you mean by all of the data. What is it all about? What does it look like when you've achieved something that you're trying to put in place with the families? So, Kaki, I think you had asked earlier about qualitative data being incorporated into these frameworks. So that's a great example too, that even on the data pages on DataShare, on these two examples, SafeRx and Cradle to Career and others, there are these quotes that have a story that's been collected as part of the programmatic work that tries to bring to life the type of change the program is seeking. So thanks for that reminder. Any questions at the moment for Sage and Julio? I want to thank you both for sharing how you got to where you are and some of the zigs and zags along the way, because that's another important point we wanted to share, is that it's pretty rare to come out of the gate with your indicators and questions and outcomes all lined up and they never change. The whole idea is that you're asking yourself, what could we be doing differently? What should we be doing differently? And adjusting and fine-tuning along the way. So don't be afraid of changing some of these ideas as you go along with more and more input. And thanks, Tracy, for your comment in the chat. So you're doing exactly that, it sounds like, updating your theory of change. And Julio, thanks for the offer. People want some support and coaching from somebody who's just been through this. It's a nice offer. And I know Eva, who had to hop off, would be happy to help as well. You are you have DataShare as a resource if you want to think about ways to create your own pages like this. I wanted to share a couple options for looking at indicators on DataShare before we dive into practicing some of this ourselves. So this is an opportunity to, if you haven't already, to think about and share some of your initial ideas, or maybe they're further along, about how you connect some of these dots for the program planning, the evaluation questions, and the community level indicators that you are contributing to, as Sage and Julio described, along with others. So one resource for doing that is the core results menu. And let me see if I can get to that with a screen share. So on DataShare, on the local progress page for core investments, you can get to this core results menu, which for each of the 8 core conditions lists some community impacts and the indicators that might be associated with them. So this is a sort of a curated list of indicators and outcomes and impacts, but organized across these core conditions. So it might be a shortcut for you if you are not wanting to go through the hundreds of indicators that are available on DataShare. So it's all clickable, and you can look at any one of these. Some of them have placeholders because they're sort of a wish list item that people knew was important, but didn't have a way to collect the data yet. So just be aware of that. And we're in the process of refreshing this because it was developed a few years ago, and we want to make sure that it's as current as it can be. But that's one option. And then another option is on DataShare itself. So let me get there. Sorry, I lost my link here. Okay, here we go. So this is the DataShare main landing page. On the data tab, you can see a bunch of other ways to look at indicators and different dashboards. But this indicators by location level, see if it'll come up for me. There it is. Gives you some ideas about which indicators are available by some of these other parameters, disaggregated data by zip code, for example. So not all of them, but some of them. So that might be helpful if you are thinking about, if you're working in a particular area or you're curious about differences across the county, different parts of the county. So this is a quick way to find out whether the indicator that you're interested in has that option. And these change over time. So everything on DataShare gets updated over time. So if you don't see exactly what you need and want at any given moment, it's worth checking back over time. And again, Eva is a great resource for if you can't get to exactly what you're looking for and what you need. So now let's take this opportunity while we're together to do a quick practice to see how this applies to your program. This is an opportunity to just think through this at first, reflecting individually and then sharing with the group and maybe getting some help or insights from others if you're so inclined. And I'll just put these questions up on the slide and Gisella will put them in the chat as well. So these are the same questions that we posed to Sage and Julio. What are some community indicators that the program or initiative that you're currently working with could contribute to? So again, these are the broader ones. It's not just on you to achieve them, but what are the things that you, along with others, could do to move the needle on some of these indicators? What are the equity dimensions that you see in these indicators? So maybe it's something that has to do with different indicators by race or ethnicity, by geographic location, by age, by other dimensions. And how would you use those? If you had this wish list, this community indicator, how would you use them to inform your program planning? What would you do with this information? And is there a specific evaluation question? It's something you're wondering about, or you would ask yourself about how your program relates to this indicator. So just think about this sequence of what's an indicator, what's an equity dimension related to it, how does it connect to your program, and what's just something you're wondering. Thank you, Tracy, for the nice note. So we'll give you just a moment to think these through. The questions are in the chat as well. And then we'll see whether anybody would like to share. And I just want to acknowledge that the steps that we've asked you to do in a few minutes here actually take months and sometimes years. So don't feel that it has to be perfect. It's just an exercise to think through it. Give it just about 5 more minutes in case anybody wants to check in on timing, and then we'll see if we want to share any. I'm going to put the questions back up on the slide just while we're pondering. But if anybody is feeling brave and ready to share, we would really welcome it. So think about that and feel free to volunteer. I think a few people had to hop off, but for those who are still here, does anybody want to share either what you came up with or a challenge maybe in trying to do this exercise that we could help with?
I can share. I'm also kind of recovering from a cold, so sorry for my voice.
Oh, okay. Thanks, Stephanie.
Yeah, so I really appreciate the presentation and just continuing to dive deeper with understanding DataShare. And I was looking really at the thriving families and the safe and just community. as I think of the thriving family, some of the indicators around the child abuse and neglect, the youth connectedness to school and experiences of childhood trauma, or and even like social emotional regulation. I think some of the indicators where like data was like unavailable, it really spoke to me because I was like, okay, how could we help to like fill a gap? You know, like how can we help to build out the data together? And then of course, you know, it's like, okay, and like what are the questions and how are we really purposeful and intentional in how we do that? One of our programs was in partnership with PVPSA and with Monarch Services. And so thinking of that like highly trauma exposed population as a way of understanding, you know, like we know that they appreciate the work, but then how are we understanding, you know, how to capture the data, both quantitative and qualitative. So that's something that we still really struggle to incorporate data into our work. And then the piece with safe and just communities really spoke to me. I think of the Children and Youth Bill of Rights. I think of, you know, the work that we're doing in Santa Cruz County specifically around those Children and Youth Bill of Rights, you know, to be free of all forms of violence and, you know, be safe at a community level is also something that really speaks to our work with children, youth, and families. And then even in the restorative justice system. So we do serve youth as well as adults that are reentering their homes and their communities. And so this all, it all feels very aligned, but it does still feel like we're kind of at like square one of understanding, like, how do we fit this into one of our priorities for, it isn't just like administrative duties, right? But it's like, this is how we're like, you know, like trickling it throughout like the DNA of our organization. So definitely we'll need some support.
Okay, thanks for sharing all that, Stephanie, and also for highlighting how connected these indicators are to one another. Often our programs and our data collection and data systems are in different kinds of silos, but these are really, that's not how families experience these things. So it's really good to think about, as you mentioned, indicators that pull from thriving families collection as well as safe and just communities. And that's how we think about the core conditions too, that they're in that diagram, those dotted lines connect them all to each other. Well, thanks for that. Does anybody else want to share your thoughts as you were trying to look at indicators and connect them to your programs and evaluation questions? Any insights, aha moments, happy dances? How about questions or challenges as you were doing this? Something that we or the DataShare team could be helpful with, for example, in a future training or technical assistance, if this was hard to do. Stephanie, go ahead. I see your hand up.
Thanks. So I think I remember, you know, sourcing like validated scales and, you know, and trying to figure out, you know, like there's already an existing body of research, survey questions and scales that are just, you know, like thoughtfully created that are, you know, like higher in effectiveness of, you know, like, are you asking what you're actually trying to measure? And so I'm wondering, is there that kind of like local database for like validated scales or surveys or, you know, like, because I know that you mentioned that this all draws upon, you know, like local and state and just like, you know, like wider bodies of research. And so I'm wondering, is that resource something that you're familiar with, or, you know, do you have any good places to point us toward?
Yeah, so in terms of like a searchable list of instruments or scales for different purposes, I don't think that's on DataShare, but there are ways to get to that. So a couple ways are there are various clearinghouses that are geared towards evaluation reports and results, and often those include their instruments in the reports. The Promising Practices database on DataShare, which we're always encouraging people to contribute their programs to and to try to make more robust, also has those kinds of tools that people have used as part of looking at their own programs, but it takes a little digging. So you might have to look at a parenting program or a promotora program or whatever your program is in the promising practices database to see how other people have measured some of those kinds of results. So it's not one-stop shopping, but maybe four-stop shopping for certain kinds of scales and indicators. And then there are often, like a mini literature review might be cumbersome, but might show you in a hurry how many different kinds of programs are using similar scales or departed from a traditional scale because it wasn't meeting their needs and what they came up with, especially in terms of the language used or the length. For example, in public health, I know there are a lot of scales that are not practical because they're so long and you don't have time or attention span from the people you're trying to collect the data from. So a lot of people have tried to streamline instruments and find that sweet spot of where, as you said, are you still getting the information that you need and that's useful without creating undue burden on the respondents. So there are things like that as well, but unfortunately not something where I think you can just punch in, show me all the scales for this indicator and how I can measure it, at least for most of them. But if other people are aware of resources like that, please let us know and share that.
Yeah, thank you so much. I think especially seeing the tab where it's, local resources and, and local progress and being able to see, what are all the organizations that are working toward, child abuse and neglect and, and safe communities and, getting us so that we're not all individually reinventing the wheels, but all asking the same questions to have, I don't know, just pipe dream, I'm sure, but just a thought out there.
Not pipe dream. I think there are organizations that organize their partnerships and convening, and as Cradle to Career described, around what can different groups contribute, what are the things that are shared goals, what are the different lanes that people are operating in that are complementary, and that can help amplify any individual organization's efforts. So on the right track, I think. Any other questions or experiences to share? Well, we hope that this has stimulated some ideas for you at least, and also shared some tools and resources that are available to you as you think about these sorts of planning activities, evaluation activities, resources like theories of change and logic models, even if they may not be called that just try to connect the dots across the different things we've talked about today. This is really just a pretty high level description of the pieces and the steps, but we hope it gives you some ideas, some new ideas and some affirming ideas about how they can all fit together. So thank you so much to Julio and Sage for sharing in such detail and candor how that worked for you. I think that's really an inspiring example and a really great way to show people how these can work and be useful, not just to outsiders like funders, but also internally to your program, and most importantly to the families you're working with and that contribute to this. We also wanted to share with you some other upcoming events, and you can see more about all of these and register for them at the core events page, which Gisella is putting into the chat. So we have coming up the second part of a two-part core coffee chat on designing for well-being, where we're working through some tools that are from the Full Frame initiative that are really helpful in thinking about the ways that we talk about well-being and do exactly what we've talked about today, plan for outcomes that are related to well-being and think about the different equity dimensions of all of this. So if you missed the first one but still want to come to the second one, you're welcome to, and there is a recording of the part one, and we also we'll do a quick overview of it at the beginning of this part 2 but there are just some great tools that we found really helpful and interesting and thought-provoking. So we hope you'll join us for that. Then we also are going to be sharing some tips and tools for designing for well-being through a webinar that many of us participated in together through the Stanford Social Innovation Review. And we're going to share some of the local examples of how people have applied the principles from that training. So it'll be similar to today, but more examples of some local applications of these principles. And so it's an opportunity to learn alongside people who've been trying to use these tools. Again, really interesting and hopefully applicable tools that we want to share with a broader audience. And then amazingly, we are almost in 2024. And in January, we will have another version of this type of data share, practicing together, exploring some topics together in a low key, but hopefully helpful forum. And that'll be on January 30th. So you can register for that as well. And we hope to see you at one of those events, but we'll also be adding some other ones. So stay tuned. We are still working on our January and February calendars for the Core Institute, but there's more to come. And feel free to suggest topics for us. We're going to be moving into a lot of training and technical assistance related to the next Core RFP. And if there are particular issues related to any of this that would be helpful to you, we encourage you to let us know so that we can be responsive to that as well. And with that, I will just thank everyone and our team, Gisella and Stella, for the interpretation and translation, Nicole for all the design work, and we will hope to see you soon. But meanwhile, thank you. Please fill out this feedback. You can scan the QR code here or follow the links in the chat. We take your feedback really seriously and we use it. So please do let us know whether this was helpful and anything we can do to improve in the future. But we thank you for hanging in there and being there today. We hope everybody who wasn't feeling well feels better soon. And everybody else stay safe and healthy, and we'll see you soon.